getting sick, Charles coughed out copious amounts of phlegm due to congestion. Phlegm. After experiencing common cold symptoms, the boy was gullible as he had carried nasopharyngitis. Nasopharyngitis. A rhinoplasty may be utilized due to people being insecure about their facial features. Rhinoplasty. The deadly infectious disease that affects the lungs primarily is called tuberculosis. After a spirometry test, the results had concluded that David had eupnia levels. It was evident that the disturbing sense of smell didn't faze him, known as anosmia. After working in a coal mine, breathing in toxic dust, silicosis can be formed and is detrimental to the lungs. Silicosis. The bacterium Bordetella pertussis causes a whooping cough known as pertussis. A condition that is explained as an abnormally low level of oxygen in the blood is hypoxemia. After following a chest ray, the results concluded that there was a presence of blood in the pleural space known as hemothorax. After having serious stomach pain, Kaylee was referred to the gastroenterology department of Union Hospital. Gastroenterology. Sarah had a ileostomy due to having Crohn's disease that required the doctor to create an opening that would bypass the colon to evacuate the fetus. Ileostomy. When a person has a fistula protruding the skin, they may need to have a fistulectomy to remove the fistula. Fistulectomy. A person who develops pouches in the walls of the colon has a condition called diverticulosis. When a person has damage to the part of their colon, they may need a colostomy to divert the colon and bypass the damaged part of the colon by an opening in the abdominal wall. Colostomy. Ulcers can form in any part of the intestines, but Sean's were located in the duodenal region of the intestine. Duodenal. Katie had a laparoscopy done to check for possible tumors around her pelvis area. Laparoscopy. Julie came into the emergency room with severe diarrhea that had a presence of blood and mucus. The doctor said she had dysentery, which caused the diarrhea. Dysentery. The condition polyposis can cause internal polypus that can affect the colon and can be a hereditary disease. Polyposis. Dan studied periodontics while he was in the college, which pertained to the structure surrounding and supporting the teeth. Periodontics. Procedures such as cystopexy is described as fixing the bladder at the abdominal wall. Cystopexy, non-existent flow of urine that is less than 50 millimeters of urine in a day is called anuria. The study of the medical specialty in the urinary system in males and females is called urology. After producing an abnormally large amount of urine, she had developed symptoms of diuresis. An abnormal amount of nitrogen-containing compounds present in the bloodstream is called azotemia. A person studying nephrology would be concerned with the physiology and diseases that pertain to the kidneys. Nephrology. Cystoscopy is a procedure that uses a tube inserted through the urethra into the bladder to see inside the bladder. Cystoscopy. Glomerular filtration is performed at the glomerulus in the kidneys. Glomerular. Pylography is used to take an image at the renal pelvis, causing an X-ray and radiopaque fluid. Pylography. A urimeter is used to measure the specific gravity of urine and is part of the urinalysis. Urimeter.